Hello, thank you for watching this week's CEO Update. My name is Eric Christensen. Just wanted to give some COVID updates here for the Heart of America Medical Center. First of all, COVID vaccinations. We're going to be moving over to Phase 1B for our COVID vaccinations, and that's for the general public. Also, employees will still be able to receive vaccinations under Phase 1A. So if you have not received the vaccination yet, please contact Jen or Karen, Jen in pharmacy or Karen in employee health, and we'll still work you in to get your first vaccine. They've also sent out a schedule for second vaccines for everybody that got vaccinated under Phase 1A, or employees and healthcare workers and people with direct contact to our patients and residents. But Phase 1B will be beginning next week, Thursday the 21st, and that's for the general public. Of course, we'll be following the risk guidance as laid out by the Department of Health. The clinic will be calling patients, so we're going to be calling people to notify them or ask them if they want to come in and get vaccinated. So we'll be notifying people on the patient list based on the risk factors that we will be following there. To let you know, if you have any questions regarding vaccination, please call our COVID hotline. That is 776-5455, extension 2201. Again, that's 776-5455, extension 2201. Also wanted to let people know, and this is for family members of our residents at our care center, Holland Estates, and just regarding visitation programs, I had looked into and start to establish an essential caregiver program. This week I've decided to put that on hold for the time being, and the reason is the federal government is concerned of any program that might circumvent their guidance at this point. I was in a very detailed conversation with state leaders, and it was felt at this time that the program should be put on hold until we get further clarification regarding just how we can utilize a program like that and make sure that we're not circumventing the federal guidance. So we have to make sure we're following CMS or federal guidance regarding visitation. So I'm going to put that on hold until I can get further guidance and clarification regarding that program. Also, just want to continue to implore the community, the staff, not to get lax regarding infection control. You know what, we're seeing a decrease of COVID in our community and in our state, but around the nation, there's still significant COVID outbreaks, and there's still possibilities of outbreaks. So I'm just asking everybody to continue to wear a mask when you're around the community, use good hand hygiene, and make sure to social distance, just to continue to use these recommendations and guidelines to help prevent COVID from getting any foothold in our community and from starting up again. So I just ask also our employees to be just good examples to the public regarding these practices and just how you communicate with everyone, just the importance of these practices so that we don't see COVID come back into our communities. Also, I just wanted to let everybody know, people are asking, when are we going to see a decrease in the regulations, masking, all these different things that they're asking. And at this point, the information is they're looking at vaccination numbers. Once we get good vaccination numbers in our communities and our healthcare employees, our residents, once we get good vaccination numbers, I think they're going to look at the rates of disease, and then we'll make determinations at that point. So it looks like it will be a number of months yet before we start to see some of the decrease in regulations, but it is coming. Once we could get the disease under control. But again, that goes back to each and every one obeying the guidelines, decreasing infection rates. I can't emphasize enough the importance of vaccination, becoming vaccinated, and getting to a point where we have a high enough vaccination rate where there's no longer a possibility of spread of the COVID throughout the community. So those are the conversations that we're having at the state level regarding these issues. Moving on from COVID, I just wanted to let the public know, and our staff, if you're not aware, that our elevator 1, that's the main elevator in the facility, the elevator right by admissions, has gone down. So we are no longer able to use it. So we're going to be installing our new elevator. We have been planning this for quite some time to install a new elevator. So we'll begin construction shortly here on a new elevator. Timeline, not sure on the exact timeline on that, looking at 8 to 12 weeks possibly. In the meantime, we are moving people over to elevator 2 by the cafeteria and utilizing that to go up to PT and long-term care. Just so everybody knows, when you go into that elevator, first floor is PT. So that is actually kind of, you would think of it as the second floor, but first floor is PT. pain clinic, all that is on the first floor. Second floor and third floor are long-term care. And again, I just tell people, if you're looking to go to a physical therapy or wellness, please don't go up to second floor, third floor. You're not allowed in there unless that's through notification and compassionate visits and those kinds of things. We do not want general public entering into second or third floor. So first floor is how you would enter in from elevator 2. Just want to let all the staff know, again, just a big thank you, how much we appreciate you for all the work that you've done. We started a new year. It doesn't feel all that new at times. We're still under all the COVID restrictions. We're still having to do many of the things that we've done over the past year here. But the good news is we're starting to see significant decrease of COVID in our community, and we're not seeing the COVID that we were once seeing through our health center. And we're getting a large portion of our staff vaccinated, and a vast majority of our residents have been vaccinated. So it's really looking good in that regard. So just want to thank all of you for all your hard work and dedication, and thank you for the community for your understanding, for just being there for us and continue to support us as a health system. So with that, I just want to thank you, and just remember, at Heart of America, your health is our passion.